Female genital system history taking. Components of gynecologic history include personal information, reason for visit, medical history, reproductive history, gynecologic history, family and medical history, social history, psychosocial history, current problems and symptoms, review of systems, lower urinary tract symptoms. What is a gynecologic health history? A comprehensive history in gynecology involves gathering detailed information about a patient's medical, reproductive, and gynecologic history. This information helps nurses understand the patient's health status, identify potential risk factors, and plan appropriate care. Personal information includes patient name, date of birth, social security number, blood type, marital status, contact, reason for visit. The main reason the patient is seeking medical attention, for example, abnormal bleeding, pelvic pain, infertility, need for contraceptives, vaginal infection, and pap smear. Medical history. Overview of the patient's general medical history, including chronic diseases, allergies, surgeries, hospitalizations, and current medications. Reproductive history, including menstrual history, obstetric history, contraceptive history, sexual history, menopause history. Menstrual cycle lasts an average of 28 days and consists of 4 phases. In the menstrual phase, menstrual bleeding occurs. In the follicular phase, the egg develops. In ovulation, the egg is released. And in the luteal phase, the uterus prepares for pregnancy. If fertilization does not occur, hormones decrease and the cycle starts again. Menstrual history, including age of menarche, regularity and duration of cycle, and characteristics of blood flow. Obstetric is information about previous pregnancies, gravida, including number of pregnancies, outcomes, term, preterm, abortion, living, complications, and mode of delivery. Contraceptive history. Types of contraceptives used by the patient or partner, both past and present, like birth control, IUD, implant, condom, injection, sexual history, information about sexual partners, health problems, orientation, activites. Stages of a woman's life. First, menstruation begins with menarche. Then comes the reproductive period, during which fertility continues. During perimenopause, hormones become irregular and a transition phase occurs. Finally, with menopause, menstruation completely ends. Menopause history. Menopausal age, menopausal complaints, postmenopausal bleeding, type of menopause, natural, induced. Menopause affects the reproductive system. Some typical symptoms of menopause include ovarian atrophy, vaginal dryness, loss of libido, hot flashes, night sweats, mood swings, and bone loss. Gynecologic history, past gynecologic problems. History of gynecologic problems such pelvic inflammatory disease, endometriosis, uterine fibroids, polycystic ovary syndrome, etc. The 3 main areas affected by PID are salpingitis, endometritis, and oophorytis. Endometriosis is a condition in which the inner lining of the uterus attaches to the outside of the uterus, forming chocolate cysts and adhesions. Types of uterine fibroids: intramural, pedunculated, subserosal, submucosal. PCOS is a hormonal condition caused by the accumulation of multiple peripheral follicles in the ovaries. The ovaries have a string of pearls appearance. Pap smears and screenings. Information on pap smears, HPV testing, and other screening tests for cervical cancer and other gynecologic conditions. Note: vaccination status should be questioned. Family medical history, information on family members' medical history, especially conditions that may be hereditary or relevant to gynecologic health, for example, breast, ovarian cancer history, social history, lifestyle factors, details on diet, alcohol use, smoking, drug use, activity, and environmental factors that may affect gynecologic health, occupation and activities. Relevant information about the patient's occupation, physical activities, and hobbies. These factors related such as pelvic floor disorders, obesity, cardiovascular risks, and high stress significantly impact gynecological health. Psychosocial history, mental health, questions about stress, anxiety, depression, and other psychological factors that might affect gynecologic health. Support system, information about the patient's relationships, social network, and living situation. Current problems and symptoms, detailed description of current gynecologic symptoms, such as pain, discharge, itching, changes in menstrual behavior, etc. Review of systems, comprehensive assessment of the patient's overall health, including any symptoms that are not directly related to gynecology but could affect treatment decisions. Basic approach for lower urinary tract symptoms assessment. When taking a history, symptoms should be categorized into 3 main groups: storage symptoms, voiding symptoms, post-micturition symptoms. This classification forms the basis of the Lutz assessment. Characterization of incontinence is evoluted detail. If leakage occurs during physical activity, coughing, sneezing, exercise, it is stress incontinence. If there is a sudden urge to urinate, it is urge incontinence. If both are present, it is mixed incontinence. Severity of leakage. How many pads do you use per day? How many times a day do you have to change your clothes? How often do leaks occur? Storage symptoms. Frequent urination during the day, nocturia, urgency. Voiding symptoms occur during urination. Hesitancy is delay initiating urination. Examples: weak urine flow and intermittent urination. Post-micturition symptoms. These are symptoms that occur after urination, a sensation that the bladder hasn't fully emptied. Post-micturition dribbling. Voiding pattern and fluid intake. Daily fluid intake, caffeine, alcohol consumption should be recorded in a voiding diary. Red flag symptoms. During the medical history, findings suggestive of serious conditions must be thoroughly investigated. Hematuria, pelvic pain, urinary retention. The obtained data are recorded. Nursing diagnoses, actual potential, and wellness are formulated. If necessary, appropriate referrals are made.